Today, with the help of courageous action taken by Democrats and Republicans in the Kentucky House of Representatives, I am coming forward to restore common sense to the mission of rebalancing the state's Medicaid budget. This mission started as a simple problem, a shortfall that came to light several months ago. In November, we proposed a solution to that problem that was simple, reasonable, and founded on programs that have worked in other states. But over the last few weeks, forces here in Frankfort who do not share the same values as the people of this state escalated this problem into a momentous battle that jeopardized our very ability to educate our children, provide health care for our vulnerable populations, and keep our streets safe. Today, however, we are taking decisive action to end this unnecessary, pointless, and wasteful struggle. In doing so, we are standing up for Kentucky's school children, teachers, state troopers, veterans, social workers, and many others. As I promised House members before they took their vote last night, I am announcing an array of line-item vetoes of numerous portions of House Bill 1, a common-sense proposal that was hijacked by Senate Republicans. Those vetoes are listed and explained in a veto message being circulated here. Overall, the reasons for these vetoes are twofold. One, the Senate's draconian cuts to basic priorities are neither necessary nor advisable. We have every confidence that we will reach the savings we projected in the second year of the biennium by adopting managed care delivery principles that many states use in their Medicaid programs and by creating other efficiencies in our program. Those savings would allow us to fill the hole created when we move forward money to fill the 2011 shortfall, which primarily resulted from an assumption made by the legislature about increased federal funds last year. Obviously, we won't know with absolute certainty the amount of savings until the next fiscal year. After all, there's a number of moving parts, including the number of Medicaid-eligible recipients, and that changes day by day. But if those savings fall short, we will find other ways to balance the budget, just as we've done since the day I took office. I have cut over $1 billion in state spending and have rebalanced the budget 8 separate times, shepherding this state through the worst recession any of us have ever seen. I will not make drastic cuts to classroom teaching, to our veterans programs, to public safety, to our social workers, to higher education, and numerous other services when there is no need to do so. Both Democrats and Republicans in the House agree with this position, and the Senate Democrats who rejected the Senate's plan agree also. The second reason for my vetoes is simple. In order to continue to find efficiencies in the budget and to spend money in the wisest way possible, I need the same flexibility that every governor before me has been afforded. I ask for no more, but I expect no less. Therefore, I'm striking an array of language, primarily proposed by the Senate, that needlessly hampers my ability to find savings and efficiencies in state operations. I've proven my ability to be an effective manager over the last 3 years, and the taxpayers expect me to continue to be one. And they've made it clear that they expect not blind and heavy-handed slashing, but strategic management that protects our priorities. In that vein, I have directed Janie Miller, Secretary of the Health and Family Services Cabinet, to notify our health care providers that the proposed 35% cuts in Medicaid reimbursement rates will, as of today, not be necessary. If you remember, I had been forced by federal law to start the notification process for those cuts, which would have taken effect next week, when it was apparent that the Senate was dragging its feet rather than fill the Medicaid shortfall. Those cuts would have cost Kentuckians jobs. Now, as you know, this special session had one other important piece of legislation on the agenda. That was attacking Kentucky's dropout problem. by raising the dropout age. We all know that Kentucky's children need more education and not less to be successful in this 21st century world. Obviously, that legislation ran into a roadblock in the Senate for the third straight time. But at least the issue was highlighted like never before, and the obstructions to its passage are now crystal clear. We will continue to work on that issue because we will not give up on Kentucky's children. Now, finally, let me be clear. This special session was totally unnecessary. It wasted taxpayer money. It needlessly raised anxiety levels for everyone from healthcare workers to healthcare recipients to teachers to police officers. And it diverted energy and attention in a time when we are trying to focus our efforts on creating jobs, improving our schools, and taking care of our families. Again, I want to thank both Democrats and Republicans in the House and the Democrats in the Senate for working with me to bring this costly session to an end, to protect our health care programs, and to uphold the values and the priorities that the people of this state hold dear. And I want to thank Secretary Miller and the rest of her staff over at the Cabinet, especially those who work in Medicaid. Her commitment, her strategic ideas, and her caring toward Kentucky's people have been a display and on display throughout this process.